my name is Grabowska, and I'm going to discuss today informatics and nursing sensitive quality indicator. I'm a registered nurse and a member of the Quality Improvement Council at Pennsylvania Hospital. In this audio training tutorial, I will be discussing the importance of nursing sensitive quality indicators and collection and distribution of quality indicator data. To begin with, I would like to present what the National Database Nursing Sensitive Quality Indicator is. In 1998, the American Nursing Association established this national database with quarterly and annual reporting on nursing outcomes at the unit level. Its principal goal is to contribute to the rapidly expanding collection of information about the specific factors that affect nursing care quality. This endeavor is crucial in part because it's the duty of the nursing profession to assess, review, and enhance practice. Nursing sensitivity indicators are designed to identify whether nurses affect their patients at the most fundamental level. The way that impact manifests itself and whether it has a net positive or net negative effect on specific patients and the community is crucially determined by these indicators though. Through literature reviews of the most widely used nursing sensitive indicators include hospital-acquired infection, mortality, failure to rescue, falls, pressure ulcers, medication administration errors, a length of stay, and patient's satisfaction. To fully understand the effect of nursing care, nursing satisfaction is necessary. Nursing sensitive indicators are divided into three measures: structure, process, and outcomes. The structure describes how the provision of health services is set up, including staffing levels, professional staffing distribution, and resource allocation. The process is used to describe the communication between patients and providers regarding how an organization operates. The results of medication treatment on a patient's health status are called outcomes. In this presentation, I would like to put an emphasis and focus on pressure injuries ulcers indicator. Pressure ulcers are skin or soft tissue lesions that develop due to persistent pressure being applied to particular body parts. They need to be treated right away because any complication from these injuries can be fatal. About 60,000 individuals every year dies as a result of the cubitus ulcer complication. The type of treatment depends on the location, stage, and ulcer-related problems. The many treatment approaches aim to keep the ulcer as aseptic or at least septic as possible by reducing moisture, pressure, and contact between the ulcer and hard surface. Patient can prevent needless suffering if caregivers consistently provide the best care. All patients may be at risk of getting a pressure ulcer, therefore, pressure area care is a crucial part of nursing practice. The paramount duty of nurses is to protect the integrity of the skin and prevent any problems. Early patient identification of those at risk of pressure ulcers is crucial to the preventable care pathway. 90% of total cost of treating pressure ulcer, and 96 of the cost for category 1 and 2 pressure ulcer are related to the time nurses and healthcare assistants spend on patients' care. Moreover, nurses and other providers must examine all surfaces that exert pressure on the skin, such as mattresses, chairs, toilets, and even automobile seats. Additionally, the shear from patient assisted and self-transfer must be considered. There are also the elements of risk prevention scale. For instance, the Braden scale for predicting pressure ulcer risk considers the patient's sensory protection, moisture, activity level, mobility, impairment, diet, and friction. Numerous healthcare providers must coordinate care and interact to maintain or recover the skin. The doctor or prescribing healthcare expert is in charge of diagnosing coexisting medical issues and ordering necessary diagnostic tests. To avoid and manage pressure regions, nurses play a crucial role. They should be able to evaluate patient chances of developing pressure ulcers by performing a comprehensive examination, utilizing evidence-based practice and well-known risk assessment techniques. To provide care without causing injury, nurses must recognize the risk factors of pressure ulcer development and put the necessary precautions in place. To prevent pressure ulcer in real life, repositioning procedures, monitoring and continuous treatment measures are crucial. Collection and distribution of quality indicator data. Now I'd like to touch upon data collection. At Pennsylvania Hospital, we utilize a system called Soft Clinic, which holds and collects data regarding patients, their disorders, ailments, restraints, prescription, medication, and etc. It's ideal for physician clinics, hospitals, and nursing homes. Nurses, of course, can collect data concerning pressure ulcers that is truly analyzed. Afterward, a report is generated, shared, and discussed with staff during meetings. Various charts and graphics may also be created. It's crucial to remember that after admitting a patient to the hospital, nursing staff must carry out a precise assessment and collect all essential information. A patient's skin should be meticulously checked from head to toe. Maintaining the patient's privacy's dignity is crucial when performing a skin assessment. If a patient is admitted to the hospital with pressure ulcer, it is documented and reviewed by healthcare professionals who begin to perform a precise care plan. Patients of nursing homes and hospitals are meant to get expert treatment and care. Even so, many patients who remained at these facilities still ended up with bed sores. According to the study, 1 in 10 nursing home inhabitants developed pressure ulcer. Stage 2 bed sores are the most noticeable kind and resemble painful bed sores. Only 35% of those patients receive the proper care and treatment. Therefore, the right care of pressure ulcer is highly required. If bed sores occur during hospitalization, a nurse must document and report them to a nurse supervisor. Afterward, a nurse is questioned and interviewed by the management team about pressure ulcer occurrence, and being throughout is significant because in case of any discrepancy, a nurse may be audited. Pressure ulcer must be documented accurately and in the right time. Pressure ulcer continue to be a common and expensive, especially in the frail older adult population and those with chronic illness. To prevent pressure ulcer, it's crucial to identify the principal risk factors and how comorbidities and related geriatric disorder affect elderly patient susceptibility. The occurrence of bed sores can be avoided using the following techniques: continually shifting the patient's weight to prevent pressure from pulling up in one area, using a customized wheelchair or stress relieved cushion, elevating the patient's bed to proper height to avoid friction and shearing, keeping the patient's skin dry and clean to avoid skin injuries, change the patient's bedding and clothing, ensuring the patient eats a balanced diet complete with vitamins, minerals and fluids. Nursing sensitive quality indicators and collection and distribution of quality indicators data help to increase patient safety and high quality patient care. According to me, a proper patient care helps to avoid any discrepancy and poor results. Patient satisfaction, safety, and care should be the highest priority of healthcare professionals. Thank you for listening and your attention. Thank you.